everyone. My name is Jose Cabañas. I am the Chief Medical Officer and EMS Medical Director for Wake County. As you all know, the Familiar Faces Collaborative is structured around bringing stakeholders together to better serve vulnerable members of our community. Our project is around providing a better integrated and coordinated service for vulnerable patients in our community. As you all know, many communities across the country are challenged with the fact that we have a number of vulnerable individuals who have a difficulty navigating scattered safety net systems, and unfortunately, the current healthcare delivery model doesn't serve them well. We all know that Familiar Faces are members of our community that suffer tremendously from mental health illness, chronic substance use problems, and lack of permanent housing. Our goal with this project is to identify those vulnerable members of our community and develop a new system that can better serve them well. You will see here two illustrations that show heat maps of individuals, patients in our community that are very vulnerable who have frequent interactions with EMS systems on a regular basis. Our data shows specific sectors in our community where a lot of our patients EMS interact with have more than 3 or more encounters every month on a regular basis.
Hello everyone, my name is Jason Wittes, Pharmacy Director at Wake County Health and Human Services, and I'm here to talk to you about our methodology to solve our WICKED problem. First, problem definition, where we identify the target population and better understand barriers and challenges associated with their access to integrated collaborative services. Secondly, coherence design, develop care models that cater to this relatively small group of individuals who suffer expensively in the shadows. And lastly, implementation, where we work with community providers to implement design deliverables and utilize continuous quality improvement practices to allow for ongoing improvement efforts. The image next to this section shows an example of our intervention workflow.
Hi, my name is Derek Hoover. I'm a consulting associate in the Department of Community Health and Family Medicine at Duke Health System. I'm here to talk today about our program activities so far. Very exciting work here. We were able to mobilize relatively quickly with the COVID pandemic and start to provide healthy hot meals to our vulnerable population, including unsheltered individuals that were living in tents and campsites in and around Raleigh, North Carolina. In building that rapport, we were able to discuss the advantages of vaccines with this population that otherwise would not have even considered vaccination, and were able to vaccinate 95% of this group. We were able to secure $247,000 worth of funding for a bridge housing pilot. In that bridge housing pilot, we are assisting individuals that have high utilization of safety net systems. For example, our first guest was in the emergency room about 53 times and used EMS 36 times in the last 12 months. I'm really excited about the work that we've done so far, and looking forward to expanding our project and working with further organizations and community stakeholders to expand and take care of this vulnerable population.
Hi, my name is Katura Beckham, and I am a community case manager with Wake Med, also a social worker. So what are our next steps? We would like to build a core Familiar Faces community team. What would that look like? It would be individuals that remain with our Familiar Faces for a longer period of time, not just 30 days, not just 60 days, not just 90 days, a long period of time to continue to support them within the community. We'd also like to have a creation, some type of tool that will have predictive analytics that will allow us to select the Familiar Faces. We need funding for sustainability. And last but not least, we would like to make sure that we have a group collaboration in place to continue to build our stakeholder group.
Thank you for watching our video. For more information, please feel free to scan the QR code located in our poster. We are the Wake County Familiar Faces Collaborative. Thank you for your time.